Welcome back to our channel. Today, we're discussing something incredibly important, the early warning signs of breast cancer. Breast cancer is a major health concern globally, affecting millions of women and men each year. Early detection is crucial for effective treatment and a better prognosis. So, let's dive into the top 10 early danger signs of breast cancer that you should never ignore. The first sign we're going to talk about is an unusual lump in the breast or armpit area. Not all lumps are cancerous, but any new lump or mass should be checked by a healthcare professional immediately. Cancerous lumps are often hard, irregularly shaped, and painless, but they can vary significantly. Understanding lumps. Lumps can form due to various reasons, including cysts, infections, or benign tumors. However, distinguishing between a benign and malignant lump can be challenging without proper medical evaluation. A cancerous lump typically feels like a hard, immovable object within the breast tissue or under the armpit. Early detection of lumps through self-examinations can help in diagnosing breast cancer early. Performing self-exams. Begin by observing your breasts in the mirror with your arms by your sides, then with your arms raised. Look for changes in contour, swelling, or dimpling. Use the pads of your fingers to feel for lumps, using a circular motion, covering the entire breast and armpit area. An excellent time to perform self-exams is a few days after your menstrual cycle ends. When to see a doctor? If you find a lump that feels different from the rest of your breast tissue, or one that wasn't there before, schedule an appointment with your doctor immediately. Tools like mammograms and ultrasounds can further evaluate and diagnose the nature of the lump. Next, pay attention to any changes in the size, shape, or symmetry of your breasts. Significant or sudden changes could be a red flag for an underlying issue. Identifying changes. A noticeable difference in the shape or size of one breast could indicate the presence of a tumor. Along with size changes, your breast may feel heavier or more solid compared to the other. What to look for? Observe your breasts in different positions, for example, standing, lying down, to spot asymmetry. Look for any visual changes such as bulging of part of the breast. Tips for monitoring. Take monthly photos of your breasts from various angles to compare any changes over time. Especially if it persists, should be evaluated by a healthcare professional. Skin dimpling, puckering, or texture changes, often described as orange peel texture, can be a sign of underlying breast cancer. This occurs when the cancer cells cause inflammation or block lymphatic vessels in the skin. Understanding skin changes. Dimpling resembles small indentations on the skin, similar to how the skin of an orange appears. These changes are caused by the retraction of the ligaments in the breast due to the presence of cancerous tumors. Checking for dimpling. During self-exams, press your hands on your hips and flex your chest muscles to see if dimpling or puckering becomes noticeable. Gentle pinching of the skin in various areas around the breast can also help reveal any texture changes. When to seek help. If you observe any skin irregularities that don't resemble your natural skin texture, see your doctor for further evaluation. A biopsy may be recommended to confirm if the changes are due to cancer. Nipple discharge. Nipple discharge, especially if it's bloody or occurs without squeezing, could indicate an issue. This sign is especially concerning if it comes from only one breast. Recognizing abnormal discharge. Normal discharge can occur due to infection, hormonal imbalances, or benign conditions like ductal ectasia. However, spontaneous discharge that is bloody, clear, or occurring from only one nipple can be a sign of breast cancer. Types of discharge. Milky discharge is often associated with pregnancy or hormonal changes. Green or black discharge could indicate a benign condition known as ductal ectasia. Bloody or clear discharge needs immediate medical attention. What to do? If you notice discharge, refrain from squeezing the nipple as this can exacerbate the problem. Seek medical advice for a detailed examination and potential imaging tests like a mammogram or ductography. Breast pain. Persistent or severe pain in the breast or nipple area can sometimes indicate breast cancer. While breast pain is often linked to benign conditions, it's important not to ignore ongoing discomfort. Types of breast pain. Cyclical pain correlates with menstrual cycles and usually affects both breasts. Non-cyclical pain is more concerning as it is localized and not related to hormonal changes. Tracking pain. Keep a diary to monitor when and where the pain occurs, its intensity, and any related activities. Note any pain that persists beyond a single menstrual cycle or is localized to one specific area of the breast. Seeing a doctor. Consistent pain in a specific area, especially if it's not related to your menstrual cycle, should be evaluated by a healthcare professional. Diagnostic tests like ultrasounds can help determine if there's an underlying issue causing the pain. Unexplained breast swelling. Swelling or enlargement of all or part of the breast, even if you don't feel a lump, can be a warning sign of breast cancer. Identifying swelling. Swelling may be accompanied by changes in texture, redness, or warmth of the breast. This could indicate an inflammatory condition that needs immediate attention. What to look for? Compare both breasts regularly, noting any differences in size, shape, or texture. Observe for any swelling extending into the armpit or causing discomfort. Persistent or unexplained swelling should be assessed by a healthcare provider. Imaging tests or a biopsy may be required to rule out or confirm the presence of cancer. Changes in the nipple, such as inversion, pulling in of the nipple, retraction, or scaliness, can be indicative of cancer. Understanding nipple changes. Inversion or retraction can occur due to fibrosis or tumor pulling the nipple inward. Scaliness, crusting, or ulcers around the nipple can indicate underlying Paget's disease of the breast, a rare form of breast cancer. Checking for changes. Inspect your nipples for any changes in appearance, direction, or texture during self-exams. Note any newly occurring issues, especially if they don't resolve on their own. When to seek medical help. Any persistent changes or symptoms in the nipples should be evaluated by a doctor. Nipple inversion, especially if new and not related to breastfeeding, should be examined. Redness or rashes. Redness, warmth, or visible rashes on the breast skin can be symptoms of inflammatory breast cancer, a rare but aggressive form of the disease. Recognizing inflammatory symptoms. Inflammatory breast cancer often presents with rapid onset of redness, swelling, and tenderness. The breast may feel warm, heavy, or have an orange peel texture due to blocked lymph vessels. Identifying redness or rashes. Look for unexplained rashes, irritation, or redness on the breast that doesn't subside with typical treatments. The absence of fever or other infection symptoms can distinguish these signs from an infection like mastitis. Immediate action. Given the aggressive nature of inflammatory breast cancer, prompt medical attention is crucial. Discuss all symptoms with your healthcare provider for an accurate diagnosis and treatment plan. Vein visibility. Increased visibility of the veins on the breast can sometimes indicate an underlying issue. This could result from a tumor that is changing the normal blood flow in the breast. Understanding vein changes. Noticeable veins could be due to various reasons, including pregnancy or weight gain. However, sudden, prominent veins on one breast can be indicative of increased blood flow to a tumor. Observation tips. Check for any new or prominent veins that haven't been visible before. Compare both breasts for symmetry and any differences in vein patterns. When to see a doctor. If you observe new vein visibility along with other breast changes, consult with your doctor. Further imaging tests may be necessary to explore underlying causes. Fatigue and unexplained weight loss. Lastly, general symptoms like unexplained fatigue and significant weight loss can sometimes be associated with breast cancer. While these symptoms can occur with many conditions, when combined with the other signs we've discussed, they can be concerning. Identifying general symptoms. Fatigue related to cancer often feels different from regular tiredness and doesn't improve with rest. Unexplained weight loss may occur rapidly without any changes to diet or exercise routines. What to monitor? Keep track of your energy levels, noting any persistent fatigue that affects your daily activities. Record your weight regularly to monitor any unexplained changes. Medical consultation. Both symptoms should be discussed with your healthcare provider, especially if they coexist with specific breast changes. Comprehensive tests including blood work and imaging may be recommended to identify the underlying cause. So, those are the top 10 early danger signs of breast cancer. Remember, early detection is key to successful treatment. Doing regular self-exams and staying aware of changes in your body can make a significant difference. If you notice any of these signs, don't hesitate to see a healthcare professional.